What are the key strategic priorities for the Defense Health Agency, DHA? How is DHA working to create a more integrated military health system? And what are some of the key successes and accomplishments for DHA over the last 4 years? I'll explore these questions and so much more with our very special guest, Lieutenant General Ronald Place, Director of the Defense Health Agency, DHA. So, sir, what has surprised you most leading DHA over the last 3+ years?
Yeah, well, the answer I'd like to give is nothing, right? Because I'm so omniscient that I can think of all these things and not be surprised by anything. But I guess the most surprising thing with an organization as large as this, with the responsibility as large as this, bureaucracy often becomes a challenge. So many things that you worry about and so many checks that you have to have before you ever do anything of purpose. I guess what surprised me the most is how quickly the agency has evolved from a largely supporting organization with primary responsibilities as managers of the TRICARE program to being way more than that, and to be able to evolve in how fast we can support things. Now, I don't mean to say that I think that we're perfect at it. I think there's still more things that we can do to become better in our supporting role for healthcare delivery, better in our supporting role at our education and training campus, et cetera, et cetera. But I'm both surprised and impressed with how quickly the staff considers what their responsibilities are and understands that the speed at which they work is mostly relevant to those who are supporting. So the adaptation, the adaptability, the flexibility, agility, et cetera, of the team to understand the change of their mission and do that and be successful in it.
I understand that DHA released its FY22-26 campaign plan, which provides a very chock full of information on how the agency will execute its healthcare mission. And so to that end, I was hoping you could outline for us the 4 key strategic priorities for leading DHA from today into the future, and how does this plan, more importantly, build on the successes of the FY21 plan and its associated efforts?
No, thank you for that. To me, it's the foundation of what the Defense Health Agency is an organization. So in order to be successful, you have to know what you're for. And the Defense Health Agency, these 4 major priorities, this is what we're for. So the first is great outcomes, which means that process matters, but through that process, you better be delivering great outcomes. And by great outcomes, that means great clinical outcomes, but it also means great administrative outcomes. Are we providing the administrative support that all elements need to lead then to those great clinical outcomes? And in order to make that happen, you have to understand what your organization is supposed to be providing those great outcomes for. So we're a military health system. So those great outcomes mean the readiness of the military force, that we do everything that we can from a medical perspective to make sure that every service member has optimal time to do their job. And all those things that we learn as a system, as a military health system, we can apply those lessons toward the care of our family members or retirees, et cetera. But what we're really here for is the readiness of that force. And the second priority is the readiness of the medical force. Are we doing everything that we can to optimize the obtaining and sustaining of the currency and competency of our individual medical teammates and our medical teams? And if we're not doing a good job at that, where's our continuous process improvement capabilities to drive further improvements in that system? The third priority is the satisfaction of our patients. And I don't mean necessarily the individual satisfaction of an individual clinical visit or a trip to the pharmacy or whatever it is. It's how do you think about the system? Is the system here for you? When you think about it, do you say, boy, I'm so fortunate that I get my healthcare in the military health system, or I get my healthcare at pick one of our clinics or hospitals or medical centers? Ultimately, our desire should be that should any patient have a choice, that they want to choose our organization because we get them, we understand them, we drive our processes to make their life better, and they know that we're here for them. And then finally, to accomplish all that, the staff have to be fulfilled. We all got into healthcare and our particular specialty within healthcare for a particular reason. We wanted to make a difference using this tool or using this technique or being part of that team. But we stay in medicine because it provides us a sense of fulfillment, that what we do matters, and that at the end of the day, we may be exhausted from it, but gosh, it was such a great day and I can't wait to go back and do it again. I can't wait to go back and work with the people that I'm just so fortunate to be able to work from. So those are the four strategic priorities for our sense making. And then in order to accomplish it, we have a series of strategic initiatives, and I'm not sure I want to get into all the details of them, but implement ready, reliable care. Are we successful as a high reliability organization? Improve patient outcomes. So not just the military service members that I mentioned, but all clinical outcomes for all of our beneficiaries. Are we optimizing the healthcare system? In other words, are we increasing the effectiveness? And in so doing, making ourselves more efficient as an organization? Is there value from all the work that we do? Are we sustaining the expeditionary medical skills? In other words, are we making sure that every single medical specialist, clinical and administrative, that they are in the technical and tactical details of every single one of their specialties ready to go? Have we enhanced the development and growth of our own teammates, both military and civilian? Are we improving the headquarters in performance, not just the clinical performance or not just the educational programs, but are we improving the way the headquarters actually supports all those functions? Are we getting the right information at the right place, at the right time, in the right format, so the best decisions can be made? So is our information system really doing everything that it needs to do? And then finally, could we execute that transition and transformation and turn that transformation of the military health system into an organization of execution as opposed to an organization in transition? And those are the strategic initiatives.
So you mentioned earlier that you came on board and took over the leadership of DHA in September of 2019. And 6 months later, on average, we had the pandemic. And the pandemic defined the agency's value to DoD in general as a trusted partner, integrating an integral partner in its pandemic response. And where I'm going with this question is I was hoping you could highlight for us the successful actions of DHA during the pandemic response, and to what extent has DHA's success in this area shown its operational value as a combat support agency?
That's an insightful question. I appreciate you asking it. In 2019, when I became the director, the organization had only been around for 6 years or so. So as an organization, not the people have been great and continue to be great, but a relatively immature organization. A lot of process work still needed to be done. A lot of anxiety about how it's all going to work. So I'm going to get into trust at the end of this. But there's a series of things that the agency was asked to do. First was personal protective equipment. You probably remember at the time, how do we protect people? What's the right gowns or masks or gloves or what are all those things? So as an organization, balance those supplies and equipment to the right place at the right time for the right people. The agency helped the services as the force providers staff civilian hospitals with people who came out of the hospitals and clinics that we're managing. Both on our installations and off our installations, our teammates were providing support to vaccination teams. So interacting with people, understanding their clinical histories, understanding their allergies, et cetera, and providing millions of doses of vaccines, thinking about, and then developing a COVID registry. So much like in our support to the combatant commanders with our work in trauma, so we've developed a trauma registry so we could better understand how well we're providing traumatic medical care services to our members in combat. Use those same expertise to develop a registry of the demographics and the treatment algorithms of each of our beneficiaries who are receiving care who are COVID positive, and then use that as a learning tool for yes, do this, don't do that, optimize this more as a tool. Very early in the pandemic, we were given the mission to collect 8,000 to 10,000 units of COVID convalescent plasma. So think about that, taking the plasma out of thousands of people and having it available to potentially transfuse into those who are really sick with COVID, as using the natural antibodies that have been developed by people to treat other Americans, other human beings. Now, that's been supplanted, of course, by the pharmaceutical companies who've made monoclonal antibodies, but at the time we didn't have any. So being able to do that and not only getting 8,000 to 10,000, actually getting 12,000 in about a 4-month period. Expanding telehealth services. The amount of care that we're delivering using telehealth before the pandemic was much less than 1% of our total amount of services. Early on in the pandemic, 50% of our services were being provided by telehealth. So that involves, of course, leading a backbone. What's your IT infrastructure? What's your bandwidth? What's the right equipment to be able to do all those things? So just all of those things to very rapidly think through, deploy, and support the actions of the organization. The bottom line is, I think the Defense Health Agency proved that it could provide powerful supports, data, systems, structure at the speed of relevance. And as I mentioned at the very beginning, it took us from I don't know if senior leaders in the Department of Defense or the American public can trust the Defense Health Agency. So pre-pandemic, I think that's a reasonable question. But post-pandemic, I think the agency has demonstrated that it is a trustworthy organization and can deliver what the American people need it to do.
That's great. Earlier, General Place, you mentioned that the pandemic coincided also with the continuing rollout of the new electronic health record for DoD, MHS Genesis. I was hoping you could give us an update on that rollout, and more importantly, what lessons have been learned and what's next?
We're about 2/3 of the way done with our rollout, and we'll continue it next year. In fact, we are on schedule. We are on budget to finish our rollout. In fact, a little bit early, but next calendar year, we'll be done with it. We finished a couple of waves this fall. We'll have here in January of 2023, we'll do our Portsmouth rollout and we'll do our Fort Drum rollout. And those are just the names there's multiple clinics, et cetera, that go with each of those waves. And in the National Capital Area, Walter Reed, et cetera, probably March or so of 2023. But the great thing about transitioning an IT system is those who are part of the process and those who are beginning the process understand the value of utilizing technology. So as I mentioned, we went from an organization that was rarely using any sort of telehealth capability to one that was embracing telehealth. Well, our new commercial off-the-shelf electronic medical record is a technological improvement. And by that, I mean a markedly technological improvement to what we had before. So understanding what we needed to do and the value that was going to come with it enabled both our headquarters staff and each of the hospitals, the medical centers, the clinics, et cetera, to embrace it. And we found ways, even when travel couldn't be done. So how do you do virtual education courses, real time, using our systems? And how do you troubleshoot them from a distance as opposed to troubleshooting them from on-site? So the great thing that we learned from the pandemic is that there are many things that we can use these health IT systems for, to include our educational systems, and be just as effective, just as useful as we were before. So now what can this valuable new program that we have, is there anything else that can do? Well, one of the things that we cooperated and collaborated with Health and Human Services was our request in the building of this commercial off-the-shelf, because we do mass vaccinations very frequently for our service members. Our annual flu drives are a good example of it, where we deliver about 3 million doses of influenza vaccine on our installations every year. Well, so we asked for that module. Well, the vendor built that module for us, but when it came time for mass vaccinations across America, then that module was shared with multiple other people, multiple other vendors, with the idea that this is good for American people. In fact, this is good for the global community. And this is how a system can be done at echelon to provide significant improvements in the way that we do vaccinations. So all of it is, how do we use technology? How do we use this system? How can we best support ourselves and support the warfighters wherever they might be, here in America or anywhere in the operational force? And the great news is, as I mentioned before, we are on time, we are on budget, we are on schedule to deliver this massive improvement to our system.
What has DHA done in the realm of education and training during your tenure? How has it expanded, and who do you help?
Thanks. A huge mission education-wise. If I could just perhaps give you some numbers or set some construct. Just within our part of the portfolio, so getting away from the Uniformed Services University and all that they do for a medical school, a graduate nursing school, a postgraduate dental school, and a allied health school. So they do that. But for us, we have two major parts of it. The Medical Education and Training Campus, which is a largely enlisted-based education campus with 16,500 graduates a year. About 2/3 of them in clinical, and about 1/3 of them in clinical administration. So think logistics or medical equipment management or medical administration, et cetera, along the way. But 2/3 of them clinicians. So their phase one is at the schoolhouse. Phase two, so it's the on-the-job clinical training. So say I'm an operating room technician. I learn how to do it. I learn how to scrub. I learn the names of the equipment. I do notional work at the schoolhouse And then I do it for real under supervision and on-the-job training out inside the field, inside of our hospitals. Similarly, we manage dozens of graduate medical education program systems. All told, we graduate about 1,200. That's 1,200 new, fully trained physicians from our programs every single year. And they could be surgeons or internists or family physicians or radiologists or preventive medicine, et cetera. So 1,200 of them. So first, it's integrating all of those things, but in particular in the medical education and training campus, partnering with huge numbers of educational institutions, 89, in fact, different educational institutions with 350 or more master's degree programs and almost 900 bachelor's degree programs. It's just a huge amount of partnerships to make sure that in that education system, we know what we're doing and we're doing it against that educational framework. And then second, as we've transitioned from that didactic lecture, sort of learning the names of stuff in the clinical environment, the partnership between the schoolhouse and the individual hospitals and medical centers where that phase 2 program, and how we're measuring the effectiveness of that phase 1 program at the phase 2 site, and how we're measuring the effectiveness of the training, that on-the-job training that happens at the phase 2 site by wherever their first duty station is. That's been improved. And then third, how do we then transition during the pandemic for optimizing what can be done in a virtual environment to what must be done in a face-to-face? And how do we provide no kidding feedback to the students? How do we providing feedback to the instructors for what's working for each of them, and then integrate it across all aspects of that system? So I'm proud of where we are. I know that like any educational system, in particular the size and complexity of what we have, and oh, by the way, the Department of Defense, or the DHA Medical Education and Training Campus, is the largest standalone medical education campus in the United States. So how do we continuously improve the systems that we have through that entire continuum of educational process?
General Place, you've led DHA through both a tumultuous and transformative period marked by, as you said earlier, the global pandemic and the maturation of the DHA structure and system. How challenging was this time for your agency, and are there any leadership lessons you'd like to share with us?
It comes with the territory. I mean, I mentioned the size and complexity of the organization. It has to be challenging, or it's not worth doing. I mean, it's the very nature of who we are and what we do. So sure, it's been challenging. I'm not sure that it's been more challenging than any other time in American history, because there's so much that's asked of the Department of Defense. So I want to put it in a little bit of perspective. I don't think that I've been particularly unique, or the agency is particularly unique. These challenges come to major elements of the Department of Defense all the time. Mm-hmm. The beauty of it is, for the American people, is that we are blessed with people who care so much about the American way of life and protecting it through the Department of Defense, that I think we start to take for granted just how complicated and complex it is, and yet we have great parts of the organization that have been successful. For me, the thing that I think has been the most challenging, and the thing that I think the organization has been most successful in, is the concept of the balance between standardization and innovation. Mm-hmm. With the idea that if you don't standardize process to begin with and then measure the effectiveness of that process, it's difficult to know if your innovations are actually happening or helping. And so what are the outcomes that you want? What are the most important things? How have we standardized the administrative process? How have we standardized the clinical support process? And what are the outcomes that come from that? And then, typically from the ground up, these are where the great ideas come from those who are actually doing that on-the-ground work, is, hey, DHA director, we think we can do that better. Okay, how? We think it looks like that. Great, let's help you flesh that out a little bit more so that your great idea has potential to be inculcated across the entire organization. And then doing that, first in a targeted location, or perhaps a couple of different targeted locations, to make sure that it's not personality dependent on the person who thought it up, but can it be successful? And if successful, don't limit it to that particular area. Rapidly advance that innovation and replace the old standardized methodology with a new standardized methodology that will be good for our system. So understanding the benefit of both standardization and innovation, but having a system that allows them to coexist in a mutually beneficial way that drives improvement in your system. That's a challenge for because here's the thing. If you're the one who invented a way of doing things, a non-standardized, then you've already put your blood, sweat, tears, your energy into it. And for an organization to say, hey, thanks for that, but we're going to do it a different way, is potentially emotionally devastating.
Yeah.
So how do you consider all the work that went in before that led to perhaps non-standardized methodology, but people who cared enough about the system to develop it? And how do you take their feedback in particular into this innovative way and make sure that whatever local innovations happened are considered in the system-wide standardization so that everyone feels valued? Balancing that is probably the biggest challenge in an organization in excess of 125,000 people.
That's wonderful perspective, sir. As you reflect on your tenure leading DHA, perhaps you could share with us, what are you most proud of during your time there?
I'm proud of the people.
Yeah.
That's what I'm proud of. But in addition to the people, it's the things that the people of the agency have accomplished. So the world, the DHA, faced a global pandemic, and because of their adaptability, their resiliency, their understanding of the speed of relevance, we were better prepared to support COCOMs and the services. The fact that we were likely not organized in the most effective way, that they've taken this opportunity, this once-in-a-generation opportunity to optimize the way that we're organized in I'm doing air quotes here that you can't see, in a merger of Air Force medicine, Navy medicine, and Army medicine in a way that optimizes the effectiveness through the balance of that standardization and innovation that I just mentioned. That we're able to transition more than 700 brick and mortar healthcare facilities from each of the different services into the DHA. And most importantly, as I also mentioned before, that largest transition of civilian workforce since the creation of the Air Force in 1947, individually caring for those 50,000 employees who transitioned into the DHA. And oh, by the way, along the way, $64 billion, that's with a B, $64 billion worth of real property that came off of property books in each of the services into the agency. And then finally, the rollout on time, on budget of our new electronic health record. Put all that together, this is an incredible team, incredible people who can get stuff done.
This has been the Business of Government Hour, a conversation with Lieutenant General Ronald Place, Director of the Defense Health Agency. Be sure to join us next time for another informative, insightful, and in-depth conversation on improving government and its effectiveness. Until then, subscribe, download, or listen to the entire interview at iTunes or on your favorite podcast app, and as always at businessofgovernment.org.